Um, so those were some interesting videos that we just saw, and I think, we learned about the teenage brain. Sometimes we don't make the best choices about what we do, and so this can lead to the most common form of head injury. Every 10 minutes, head injury claims the life of another child. Head trauma is the number one cause of death and disability among people between the ages of 1 and 44. So in this segment, what we're going to do is we're going to look at traumatic brain injury, which is the most common form of brain damage, and then we're going to look at stroke. So closed head injury, it's also called traumatic brain injury, TBI. The brain bangs against the inside of the skull but does not actually puncture the brain. So I showed you some videos, and those were some examples. Also, car accidents. It's very common to have a traumatic brain injury. They tend to form blood clots that interrupt normal blood flow to the brain, causing problems. The difference between a traumatic brain injury and a concussion is the AAN, which is it's something like the American Association of Neuroscience defines concussion as an alteration of mental status due to a biomechanical forces affecting the brain. The AAN definition does not require a loss of consciousness. So if you hit your head really hard, then you may have some problems, with headaches and so on and so forth, and this could be considered a concussion. So like I said, is the traumatic brain injury, motor vehicle accidents, firearms, minor blows to the head, sports, and random accidents. So most deaths from firearms, most deaths from the traumatic brain injury come from firearms. Then you have vehicle accidents, falls, and other. The greatest number of TBIs occur in people ages 15 to 24. So that's why I showed you the videos, is that kind of stuff. But I mean, there could be car crashes and, firearms, but I chose to show ones, where they weren't fatal. It was something that could be recorded. Regardless of age, TBI rates are higher in males. Men suffer twice as many TBIs as women do and have a fourfold risk of fatal head injury, and males account for 2/3 of childhood and adolescent trauma. So 15 to 24 is when we're going to find out is when testosterone levels are at the highest, and so we tend to take a lot of risks at that time. And then we learned about the teenage brain, that the frontal lobe isn't fully developed, and so this may account why we engage in some risky behaviors. In cases of vomiting, drowsiness, personality change, or severe headache, the victim should be transferred to a medical emergency unit. Mild headaches and slight dizziness after a head injury is expected and does not necessarily require medical aid if these symptoms do not persist. So these are some things that you should look at, is if the person starts vomiting, if they feel very, very sleepy, maybe you want to get them checked out, personality change, severe headache. Another big telltale sign that something could be wrong is if their pupils are differently dilated. Like if the one on the right is small and the other one on the left is large, that's definitely where you want to get them to a medical emergency unit. So these are some symptoms from a traumatic brain injury: constant fatigue. All of a sudden they develop sleep disorders. All of a sudden they have vertigo disorders. That's when it's feeling spinning, the dizziness. They didn't used to get headaches and migraines, and now they start getting them. This is something where you should probably go to see the doctor. All of a sudden they develop depression or anxiety disorder, what they'd never had before, speech problems, neck and back pain. So from hitting your head really hard, if you see some of these symptoms develop, that's something that you want to get checked out, so that is there anything that you can take care of, because sometimes traumatic brain injury can lead to a stroke or some real damage, but if it's caught early, maybe there's something they can do. Symptoms can be triggered immediately or can take months or years to develop.